All right. So again, good evening, everyone. I think we'll go ahead and get started since we have a lot of information to cover and I don't want to keep you guys too long. We may still have some people coming in as we go, but let's go ahead and get started. So again, good evening. Thank you for joining us. This is the Medicare 101, part 1 of a 4-part series, and this is in partnership with the Security Library. I am going to be covering a lot of information tonight. Hopefully everybody got the email that I have sent out. I sent it out to most people about an hour and a half ago. I sent it to last minute registration just a few minutes ago. The email does include the slides that goes with tonight's presentation, as well as some additional handouts. If anybody did not get that email, please feel free to let me know. I will be pausing during the presentation at different intervals to allow people to ask questions. You're welcome to type a question at any time into the chat box, and I will address your questions when I do pause at the different intervals, or when I do pause, you're welcome to simply unmute yourself and ask your question live. And I think that's all the housekeeping I have, so we'll go ahead and get started. So again, this is part 1 of our Medicare 101 4-part series. And tonight we're going to be talking about Medicare eligibility and coverage for both Medicare Part A and Part B. So I will start with who we are. I am with the Pikes Peak Area Council of Governments Area Agency on Aging. And the mission of the Area Agency on Aging is to work with our community partners and community governments to develop and implement comprehensive systems that keep people in their homes in the community for as long as possible. The Area Agency on Aging serves 3 counties of Colorado: El Paso, Park, and Teller. My name is Roma. I am with the Area Agency on Aging's SHIP program, or Senior Insurance Assistance Department, which houses the SHIP program. The SHIP program stands for State Health Insurance Assistance Program. This is a federally funded program that's designed solely and specifically to provide free and unbiased information and education on all things Medicare to anybody who is interested, including Medicare beneficiaries, families, friends, and caregivers. So we can provide information on education on all parts of Medicare, all Medicare insurance options, as well as other options that might be available to beneficiaries, such as retiree benefits, etc. The SHIP program out of the Area Agency on Aging actually serves 9 counties of Colorado. I've listed them on the slide. Every county and every state has access to a SHIP counselor, if nothing else by toll-free number within that state. I have listed the Colorado's toll-free number. Anybody who calls that number will be routed to the SHIP office closest to the county they're calling in. I've also listed our local Colorado Springs number. We are located in the Colorado Springs area, but again, we do serve a total of 9 counties in Colorado. So tonight we are going to be talking about the different parts of Medicare. We're going to start with Medicare Part A and Part B. So we're going to talk about eligibility to enroll in Medicare A and B, how to enroll in Medicare A and B and when, and what Medicare A and B covers and what it costs. Next week, we'll talk about other health insurance options to go with A and B. In week 3, we'll specifically cover all things Medicare Part D, the prescription drug benefit. And on the last of our 4-part sessions, we will talk about insurances that could go potentially with Medicare, such as Medicaid, employer coverage, etc. But tonight we're going to focus on Medicare A and B. And we're going to start with how to get A and B. So what people need to primarily understand is that Medicare eligibility is primarily determined by Social Security. So it's the Social Security Administration who actually determines who is eligible to receive Medicare. They process Medicare enrollments, so you have to contact Social Security to enroll in Medicare. They provide initial Medicare cards and replacement cards. And Social Security is available 5 days a week, Monday through Friday, from 7 a.m. to 7 p.m. in all time zones by their national toll-free number. You can also reach our Social Security through their website, and you can create a personalized Social Security login that allows you to look at your work history, how much you've paid into the system, whether or not you're eligible. You can request and print temporary and duplicate Medicare cards, that kind of stuff. Social Security does have brick and mortar locations that typically people can go to if they have issues that they need Social Security to help them deal with, such as enrolling in Medicare. Unfortunately, right now, I do believe Social Security brick and mortar locations are still closed to the public. And we expect that to continue for at least a couple of more months. Once somebody is enrolled in Medicare, Social Security wants nothing to do with you. If you have any questions or concerns or need any information about your actual Medicare benefits, you would have to contact the Centers for Medicare and Medicaid Services, also known as CMS. We'll simply refer to them as Medicare tonight. Once you're enrolled in Medicare, you would have to contact Medicare for any questions about benefits, about claims, that kind of stuff. So CMS processes all the claims for Medicare. They determine what benefits are going to be covered under Medicare. They pay the Medicare providers directly to provide services to you. Medicare is available 24 hours a day, 7 days a week, 365 days a year by toll-free number. Or you can go to the Medicare website, medicare.gov. There is no brick and mortar location for Medicare. Does not exist. The only way you can contact Medicare directly is by toll-free number or by going onto their website. So who is eligible for Medicare? Most people who have worked in their lifetime and paid income taxes, and as a US citizen who is turning age 65 will automatically become eligible for Medicare. And again, that's a determination that's made at Social Security, and that's going to be based on whether or not you've paid income taxes into the Social Security system. People at any age can become eligible for Medicare based on being determined to be disabled by Social Security. If someone is approved for Social Security disability, once they receive 24 disability income payments, they would automatically become eligible for Medicare at any age. If anybody is diagnosed with end-stage renal disease or is receiving kidney dialysis, you can become automatically eligible for Medicare at any age. Or if you're diagnosed with Lou Gehrig's disease, also known as ALS, you can get Medicare at any age. And then any lawfully admitted resident alien who has resided in the US for at least 5 consecutive years is eligible to purchase Medicare. So when should you enroll in Medicare? So there are several enrollment periods that everybody should be aware of. And we're going to talk about each of those periods in a little bit more detail. But for most people, what they need to be aware of is their initial enrollment period. So in order to enroll in Medicare, you don't have to be retired. And many people are continuing to work past age 65 these days. Whether you choose to continue to work or not, when you are turning age 65, you do need to be aware of the initial enrollment period into Medicare. So anybody who's becoming eligible for Medicare gets a 7-month window called their initial enrollment period. And that 7-month window is the 3 months prior to the month of eligibility or the month of their 65th birthday, the month of, and up to 3 months after month of eligibility or month of 65th birthday. During that 7-month window, you can enroll in Medicare without penalty. If you enroll anytime in the 3 months prior to your eligibility or 65th birthday, your benefits will go into effect the first of that month of eligibility or 65th birthday. If you enroll during the month of or any of the 3 months after that 65th birthday or month of eligibility, there will be a slight delay in when Medicare goes into effect of 2 to 3 months. Other times you might be able to enroll And these are the 3 primary enrollment periods someone needs to be aware of. And again, we will talk about them in more detail as we go. So the initial enrollment period surrounding initial eligibility. Then for those who choose to continue working and have employer group health coverage through that work, would be able to delay enrollment into Medicare until they stop working in favor of the active employer coverage for healthcare. Once that person stops working, they would have an actual extended amount of time to enroll in Medicare without penalty. So if you delay enrollment into Medicare because you're still working with employer coverage, once you quit working, you have an additional 8 months to enroll in Medicare without penalty. If for some reason you don't enroll in Medicare during your initial enrollment period, you don't fall under a special enrollment period because you were working and had group health coverage, Medicare will allow you to enroll in benefits any year down the road during the general election period. The general election period happens every year from January 1st through March 31st. And typically, if you are enrolling in during that general election period, your coverage won't start until July 1st. And you may have to pay penalties, meaning you may have to pay a higher premium for your Medicare because you didn't take advantage of the first 2 enrollment periods. So this is what the Medicare card looks like these days. I simply refer to it as the red, white, and blue card. Medicare ID cards will simply have your name, have your random Medicare ID number, which is just a random series of numbers and letters. And it will indicate when Medicare Part A and Medicare Part B go into effect. And that's all it will ever indicate. It will never indicate any other benefits you may choose to enroll in or you may have to go with your Medicare. Things to be aware of when you're becoming eligible for Medicare. First and foremost, it's probably going to be very, very important that you make sure that your contact information or your address is up to date at Social Security. If your address is not up to date at Social Security and you are becoming eligible for Medicare, when Social Security sends you that red, white, and blue Medicare card and it doesn't go to your current address, there is strong potential that someone might get a hold of that card and use it inappropriately or fraudulently. So it is always a good idea to keep your information up to date at Social Security. Again, you can do that by going online and creating a My Social Security account, or you can simply call them. Another thing to be aware of is that if anybody calls you to ask if you've gotten your Medicare card, or if if you have your Medicare number, please be aware that that's probably not going to be a legitimate call. Medicare nor Social Security will call you for any reason to verify that you have received a Medicare card. If you don't get it, you should call them, but they're never going to call to see if you received it after they put it in the mail. So any calls that you get in that regards are probably going to be fraudulent and should be reported, honestly, either to us or to the Federal Trade Commission or to the Division of Insurance. Any one of those sources would be adequate to report that kind of fraudulent call. In the email I sent out earlier this afternoon, I did include a couple of handouts from Social Security. One of them was on how to create a My Social Security account online, as well as the benefits of doing so. The other handout, which is what we're looking at here, are some of the different types of things that you can do at the Social Security website, not necessarily by creating an account, but just in general. So hopefully you find those handouts useful. I also included a handout that walks you through creating a Medicare account on the Medicare.gov website. This is a much simpler process to create an account on Medicare.gov than it is to create an account on SocialSecurity.gov, simply because the account you create on SocialSecurity.gov does need to be much more secure. So it takes a little bit longer to set up. That's not a bad thing. Neither the Medicare account nor the Social Security account are required. They're encouraged, but you do not need to have an account on either of those sites to do what you need to do, whether it's enrolling in Medicare or looking up benefits. There are definite advantages to having those accounts, but again, they are not required that you have those accounts. So I will pause there to see if there are any questions. Again, if you have any questions, you're welcome to simply unmute and ask your question or type it into the chat box. I do have a question in the chat box. Do I need to live in the USA to qualify for Medicare? So the way that works is if you are a citizen of the United States, you've paid income taxes, and you are eligible for Medicare, you do qualify for Medicare, and you can enroll in Medicare whether you're living in the United States or not. However, Medicare does not work outside of the United States and/or our territories. So even if you enroll in Medicare, you're paying for Medicare, but you leave the country, Medicare does not go with you. It is not good outside of this country. And so it would not be accessible if you go out of the United States. A lot of people are hesitant to pay the premiums for Medicare if they intend to reside outside of the United States for an extended period of time. You can certainly opt to do that. However, when you come back to the United States and then re-enroll in Medicare or enroll in Medicare for the first time, unless you were actively employed while you were out of the country and had health coverage through that employer, you would be penalized for late enrollment into Medicare. So those are things to keep in mind if you do plan on going out of the country for an extended period. So hopefully that answers that question. And that's when I say extended period, I mean you intend to reside outside of the United States and not just go for an extended visit. So again, hopefully that answers that question. Are there any other questions that anybody has? All right. Not hearing any questions or seeing any questions, so we will move on. So now we're going to talk about the different parts of Medicare. We're going to start with Medicare Part A. Medicare Part A primarily covers hospitalizations. Things to take into consideration about enrolling in Part A. First and foremost, people should understand that if you are collecting a Social Security income of any kind for any reason, at any age, when you become eligible for Medicare, Social Security will automatically enroll you in Medicare. Not only will they automatically enroll you in Medicare, but they will automatically start deducting the Medicare premium out of your Social Security income. Again, if you are actively employed or you're the spouse of someone who is actively employed and you are covered under that employer health coverage, you can opt to delay enrollment into any part of Medicare in favor of that employer coverage. And then when that employment ends and that employer coverage ends, you would be able to enroll in Medicare at any time without penalty. Again, you'd have 8-month window from the time the employer coverage ended to enroll in Medicare without penalty, or you can also enroll in Medicare without penalty anytime while you're still actively working or covered under that active work employment health coverage. Otherwise, if you're not actively employed or covered by a spouse's active employer health coverage, if you're collecting Social Security income, again, Social Security will automatically enroll you in Medicare and start deducting the Medicare cost. If you're not collecting an income, but you're also not actively employed with employer health coverage, it does become your responsibility to contact Social Security and tell them whether or not you want to enroll in Medicare. If you intend to continue working, you have employer coverage, you do not have to contact Social Security to let them know you don't want to enroll. So if you're not being automatically enrolled, you're still working, you have employer health coverage, you do not have to contact Social Security about enrolling in Medicare until you're actually ready to enroll in Medicare. Now, if you choose to enroll in Medicare while you're still working, you can also do that. A lot of people will enroll in Medicare Part A if it's at no cost to them while they're still actively employed with group coverage, but delay enrollment into Part B. Some people will enroll in both A and B, depending on the size of the employer. The employer coverage is typically still going to be your primary insurer, and Medicare, if it's enrolled in, would become your secondary insurance. For most people, again, Medicare Part A is available to them at no cost. In order to earn Medicare at no cost, someone would have to have paid into the income tax system for a total of 40 quarters. And the 40 quarters, the quarters are what Social Security keeps track of. And that equates to basically a total of 10 years of work history of paying income tax. That 10 years of work history can be accumulated at any point over the course of your entire work history. So if you worked for 10 years and then you got married and had a family and stayed at home to take care of the family and didn't go back to work for 30 or 40 years, when you earned that first 10 years of work history, you have already earned your Part A at no cost. If someone worked a couple of years, while they were in college, had a family, chose not to work while they were raising the family, went back to work after the kids were out of the house kind of thing, you may have to work a few more years in order to have earned all 40 quarters. You may have only worked part-time over the course of your lifetime, and it may have taken you 20 or 30 years to earn a total of 40 quarters. As soon as you earn those 40 quarters or have a total of 10 years of work history paid into the income tax system, Part A will be free for you when you become eligible, period. For those who have less than 40 quarters when they become eligible for Medicare, you can purchase Medicare Part A. It's not cheap. Premium can be as high as almost $500 per month this year. However, Social Security, when you contact them about that, and again, it is Social Security who determines how many quarters any person has. So if you're not sure if you have enough quarters or not, you would have to contact Social Security to get that information. Other people who may have not worked because they stayed home and took care of the family or what have you, and don't have enough quarters for free Part A, may also be able to get Medicare Part A at no cost through their spouse's work history, as long as they and their spouse have been married for at least 10 years. It is possible to even get it on an ex-spouse's work history if you and that ex-spouse were married for at least 10 years. Again, any of those options might be available to somebody, but it is Social Security who determines who's eligible for what. And Social Security can go through all of those potential options with you to see which option best suits the situation. So even if you don't have enough work history on your own work record, there may still be ways to get Part A for free based on a spouse's work history. But again, you would have to call Social Security to make that determination. I will address this question real quick before we move on. There's a question in the chat box that says, if I have employer coverage through my spouse, do I have to enroll, I'm assuming, into Medicare to avoid penalty? No, as I just explained, if you are actively employed with employer group coverage, or you're the spouse of someone who is actively employed and you're covered by their employer group coverage, you can delay enrollment into Medicare, into any part of Medicare, in favor of that active employment group health coverage. And when that employment ends and that coverage ends, or any time before it ends, you can enroll in Medicare without penalty. So hopefully that answers that question. So again, for most of us, Medicare Part A will be at no cost. Medicare Part A is, again, primarily going to be for inpatient hospitalization. So anytime you are in need of a hospital stay as an inpatient, Medicare Part A covers all inpatient hospital costs except for a deductible. For 2022, that deductible is $1,556 per admission. So that potentially that deductible could be applied multiple times if you have multiple hospital admissions in a given year. But above and beyond that $1,556 hospital deductible, whether you're in the hospital for 1 day for a minor surgery, or if you're in the hospital for 60 days for a catastrophic medical need, Medicare covers all costs above that $1,556 deductible. So whether it's a $5,000 hospital bill or a $500,000 hospital bill, it's covered minus that deductible. And that covers you up to 60 consecutive days in the hospital, which hopefully would be a very rare or never scenario. However, if you do find yourself in the hospital for 60 days or longer, starting on day 61, Medicare will continue to pay for your hospitalization, but they will start applying what they call a coinsurance. What that means is Medicare will continue to pay all costs for that hospital stay minus a $385 coinsurance per day from day 61 through day 90. Again, these have to be consecutive day stays, which for most of us should be a very rare or never scenario. Medicare considers a 90-day consecutive stay a benefit period. So you're covered up to 60 days with only cost of $1,500 deductible. From 61 to 90 days, you have an additional cost of a daily coinsurance of $389 this year. If for some unfortunate reason you are still in the hospital after 90 days, that coinsurance does go up to 778 days, and you start eating into lifetime reserve days. You get an additional 60 days of lifetime reserve days above and beyond that initial 90-day benefit period. Medicare will cover your inpatient hospital needs as often as you may ever need them. There is no limit to what Medicare will cover for inpatient hospitalizations or how often they will cover them. But for extended stays of 90 days or greater, they do put a limit on how many more days above and beyond they will pay for that. Again, 90 days is considered a benefit period. You would have to have at least 60 days from the time you're discharged as an inpatient from the hospital to the time you're readmitted as an inpatient to a hospital before a new 90-day benefit period would apply and before they would apply a new $1,500 deductible. If you have less than 90 days between admission or discharge and admission, you may not have to pay that deductible again. Sometimes it does depend on why you're going back into the hospital. Sometimes it doesn't. And how that's determined is all based on how the hospital submits those claims. Medicare also covers inpatient psychiatric hospital stays, but Medicare does put a lifetime maximum on how many days they will pay in a psychiatric hospital for inpatient care of 190 days for your lifetime. Things that are not covered while you're inpatient in the hospital are going to be what used to be considered personal convenience items. These days, most hospital rooms come with these items at no extra cost, such as your own telephone number or a TV. Medicare will not pay for you to have a private room all to yourself unless it's deemed medically necessary and ordered by a doctor, or even if it's a scenario where there's no other space available to put you, they have to put you in a private room, that would not be counted against you. Medicare, no part of Medicare, A or B, will pay for the first 3 pints of blood someone might need. Don't ask me why. I have no idea, and they've never been able to give me a clear answer, nor do I have any idea what blood costs. I just can tell you that no part of Medicare will pay for the first 3 pints. Part B does start paying at pint number 4. Part A will not cover private duty nursing while you're in the hospital or room sitters. And Medicare does not cover what they consider self-administered drugs while you're in the hospital. Typically, this is going to be a situation where you'll only encounter a self-administered drug on the day of discharge in the hospital. On the day you're being discharged, technically you're no longer considered an inpatient, but if it's taking them forever to discharge you and it comes time for you to take your maintenance medications and you still haven't been discharged, the nurse may come around with a cup of pills and say, here, it's time for your meds. If you take that cup of pills and swallow them, you could potentially be billed separately for those drugs. On the other hand, under Medicare Part D, you can submit those costs to your Part D, and Part D may actually reimburse you. Again, just something to be aware of. Other things that you should be aware of in a hospitalization stay. If you go to the hospital, say in an emergency situation, and they send you upstairs and put you in a room, that does not necessarily mean you've been admitted to the hospital. You could be in the hospital under observation. It is very important to understand whether or not you've been admitted or if you're under observation, and for you to ask if you've been admitted or are under observation, or to have a family member ask if it's the same. The reason it's important is because if you're admitted to the hospital, your benefits are covered under Part A. If you're under observation, your benefits are covered under Part B. There have been situations where people have been in the hospital for several days, but are classified under observation and were never officially admitted to the hospital. Depending on the situation, if for some reason, after that observation hospitalization of multiple days, the doctors wanted to send you to rehab for some reason, if you've been under observation instead of been admitted, Medicare will not pay for that rehab if you're discharged to rehab. So just another thing to keep in mind, hospitals are required to advise you within 24 hours whether or not you've been admitted or if you're under observation, and they're required to provide you with a piece of paper that explains that and for you to sign it so that you can testify that you have been advised and understand. Don't be afraid to ask questions in those kinds of situations. Medicare Part A also covers inpatient skilled nursing facility care. Basically, this is going to be your rehab or recovery stay. So if you have been admitted as a patient to a hospital and you have had at least 3 days of inpatient hospitalization or longer, and then you're discharged into a skilled facility for rehab or recovery, Medicare will pay 100% for the first 20 days of that skilled facility stay for rehab and recovery. And they'll pay 100% for those first 20 days. If you are in rehab or recovery for longer than 20 days in that skilled facility, Medicare again will continue to pay for that care, but they will start deducting a daily coinsurance, meaning they will continue to pay all costs for your continued rehab stay, except for $194.50 per day. That is a coinsurance. Medicare will pay all or part of up to 100 days at a time in a skilled facility for rehab or recovery. That 100-day benefit period Medicare pays all or part of is considered a benefit period. You would have to have a 60 days window between the time you're discharged from a skilled facility to the time you're readmitted to a skilled facility after another 3-day or more hospital stay before you would start a new 100-day benefit period. Most rehab stays after hospitalization are going to average 4 to 6 weeks, but Medicare will cover up to 100 days. If for some reason you are still in that skilled facility, receiving rehab or recovering, and you have not gotten well enough to go home after 100 days, the reason Medicare benefits stop at 100 days is because they have determined that if you're not well enough to go home, even if it's to go home with additional rehab at home or additional home care at home, then the likelihood of you ever being able to go home starts to become pretty slim. So at 100 days, Medicare benefits cut off, regardless of why you're there. And at that point, if you continue to be in that facility, you are looking at having to pay that cost 100% out of pocket. Or if you have purchased long-term care health insurance, it may help cover some of that cost. Or in some cases, people may be eligible to apply and have Medicaid pay for that continued care stay. Again, a 100-day benefit period, Medicare will pay a 100-day benefit period as often as anybody ever needs them for the rest of their life. There is no limit to how often you can use this benefit. But again, once you've reached 100 days, or if you have reached a point in your rehab or recovery to where you're no longer going to continue to improve, even if it's only after 2 weeks, that's when Medicare benefits will cut off. Or if it's 6 weeks, As soon as you have gotten as well as they can get you and they can send you home, that's usually when Medicare benefits will stop for that service. Or if you're there 100 days, they'll stop at day 101. The last benefits available under Medicare Part A are going to be the home health care and hospice benefits. For home health care and hospice services, both of those services do require that a doctor determine your eligibility and certify, basically tell Medicare that you are eligible based on their visit with you. And the doctor would have to continue to certify that you're eligible for those benefits on an every 60 to 90 day basis until you are no longer eligible for those benefits. Having said that, there is no limit to how long you can receive those benefits. The home health care benefits are designed only to cover medically necessary home health care, such as physical therapy or occupational therapy, wound care, that kind of stuff. What the home health care benefit through Medicare Part A will not pay for is going to be homemaker services. It will not pay for personal care assistance unless that is required as part of your medical need care. And again, once you have gotten well enough to no longer need that level of care, benefits will stop. Medicare will stop paying for that service. But if you do qualify, the doctor certifies your eligibility. There is no limit to how long you can receive that care as long as you continue to meet the criteria, and Medicare pays for those services at 100%. The same with hospice care. The hospice care benefit is the end of life coverage of Medicare benefits. And it is basically a program that is designed to make someone comfortable, or as comfortable as possible, in an end of life scenario. Technically or primarily, to be eligible to receive hospice care, the doctor does have to certify that you have a potential lifespan of 6 months or less. However, that does not mean you have to die in 6 months or less. Again, there is no limit to how long you can receive this benefit as long as the doctor does continue to certify that you meet the eligibility criteria. Services will be covered at 100%. And again, most services will include anything that will help someone be comfortable or as comfortable as possible in an end of life situation. So it can provide medications to make you comfortable. It can provide any medical equipment that is going to help make you comfortable at home, such as wheelchairs, walkers, or in-home hospital beds, oxygen, that kind of stuff. Nursing care, personal care, all of those kinds of things covered at 100% for as long as you need them. So that is basically Medicare Part A in a nutshell. Are there any questions about any of that so far? Again, you can always type questions in the chat box or simply unmute and ask your question. Okay, I'm not hearing any questions, so we will move on. So now we're going to talk about Medicare Part B. Medicare Part B basically is going to cover all your outpatient services. Things to take into consideration when you're eligible for Medicare Part B, just as you would consider when you're eligible for Part A. Again, if you're already collecting a Social Security income for any reason, Social Security will attempt to enroll you in Medicare automatically and start deducting the cost of Medicare automatically out of that Social Security income. Again, if you're actively employed with employer group health coverage, or you're a spouse of someone who's actively employed and you're covered under their employer group health coverage, you can potentially delay enrollment into Medicare until that coverage ends. For Medicare Part B, everybody has to pay a premium. So for most people, Part A is at no cost. For everybody, Medicare Part B is a cost. There are some situations where you would absolutely have to have both A and B, and that would be primarily in situations involving coverage that goes with A and B. So if you are wanting to get into a Medicare supplement or Medigap policy, you have to have both parts A and B of Medicare. If you want to enroll in an Advantage plan, you have to have both A and B of Medicare. If you're retired military and you have TRICARE for life. When you become eligible for Medicare, they require that you enroll in A and B of Medicare, and any TRICARE benefit you had prior to Medicare automatically transitions to TRICARE for life and acts as a supplement or secondary insurance to Medicare. If you don't enroll in Medicare and you're not actively employed when you become eligible for Medicare, but you are a military retiree, if you don't enroll in Medicare, you could potentially lose TRICARE benefits. So again, unless you're actively employed, if you're retired military, you would want to enroll in Medicare at initial eligibility. I do get a lot of veterans who ask me whether or not they need to enroll in Medicare if they use VA for all services. Honestly, I encourage people to do so, but they're not required to do so. And just so everybody knows, there is nothing that says you are absolutely positively required to enroll in any part of Medicare. It is a choice, it is an option, and you do not have to enroll in Medicare if you choose not to. There are implications if you decide down the road you want Medicare, and you have to worry about penalties and whatnot, but nothing says you have to enroll in Medicare for any reason. So for VA beneficiaries who use the VA system for all their care, there are definite advantages to enrolling in Medicare, simply because the VA system will generally take care of VA service issues. And it could be a situation where there are limited VA facilities in which to get care. Whereas if you also enroll in Medicare, Medicare is good anywhere in this country for any medical need at any time with any Medicare provider. So it does give someone the freedom to get whatever they need, whenever they need it, wherever they need it outside of the VA system. If someone chooses not to enroll in Medicare because of the VA system, again, they're welcome to do that. But if down the road they decide they want to enroll in Medicare, they would have to do that during a general enrollment period, and there could potentially be penalties for not enrolling sooner. Again, we've talked about several times already that if you are still actively employed and have employer group health coverage through that employer, you can delay enrolling in Medicare. And when that employment ends, you would have a special enrollment period, which is actually an extended amount of time to enroll in Medicare without penalty, an 8-month window from the time the employer coverage ends. Or again, anytime while you are actually employed, you can enroll in Medicare. And then once again, if you miss that initial enrollment window when you first become eligible, you weren't actively employed, or you don't enroll in Medicare within 8 months from that employer coverage ending, you would have to wait until the next general enrollment period, which is January 1st through March 31st. And you would likely be looking at having to pay higher premiums for Medicare because of late enrollment penalties. So what is Medicare cost? For 2022, the base premium for Medicare Part B did go up quite a bit between last year and this year. For most people, Medicare Part B will cost $170.10 per month per person. If, again, you are collecting a Social Security income for any reason, when you become eligible and enrolled in Medicare, that $170 premium will be deducted from Social Security automatically. You will not have a choice in that. If you're not collecting an income, so say you become eligible for Medicare at 65, but you're going to choose to wait until full retirement age of 66 and some months before you start collecting a Social Security income, you can arrange to pay Social Security directly for your Medicare premium, either by quarterly paper bill, or Social Security, just within the last several years, has arranged to have electronic funds transferred set up so that the premium can be deducted electronically from your bank account automatically every month. But those are really the only ways Medicare can be paid for, either automatic deduction, or you get billed quarterly, or you set up electronic payments. If for some reason you are looking at a potential Medicare premium for Part B, the way the premium is calculated, or the penalty is calculated, so if you're looking at a potential late enrollment penalty, The way that's going to be calculated is for every 12 full months, 12 full month period that you were without Medicare and you did not enroll during your initial enrollment and you were not actively employed or covered under active employer group coverage. Every 12 full month period that you had no coverage, they will assess a 10% penalty. So if you go 3 years without enrolling in Medicare, you had no other health coverage through employment, and you did not enroll during initial enrollment, when you do enroll in Medicare 3 years down the road, you are looking at a potential 30% penalty. That 30% is going to be multiplied by whatever the Part B premium is 3 years from now. Whatever that comes out to is going to be tacked on top of the premium 3 years from now. So for example, if you were eligible 3 years ago, and now this year you're going to enroll in Medicare, they're going to take 30%, multiply it by $170. Whatever that comes out to is going to be tacked on top of the $170 every month forever. Penalties never go away, and they are monthly. The longer you wait, the higher that penalty gets, because that 10% is accumulative. So if you wait 5 years, you're looking at 50%. If you wait 10 years, you're looking at 100% penalty. Again, penalties last forever, and that amount can add up quite a bit. Also keep in mind that Medicare premiums increase every year. Last year, the Part B premium was $148.50 a month. This year, and because we got such a high cost of living increase from the government this year, the premium jumped up more than it usually does. Quite honestly, this is the highest jump in Part B premium I've seen in 20 years, to $170.10. Even though the premium will not jump up that much every year, you can count on some sort of increase to that premium every year. Once you enroll in Medicare Part B, you will have a deductible. The Part B deductible is a one-time-a-year annual deductible. And all things considered, it is not a very big deductible. Whereas most employer plan deductibles these days are in the $6,000 to $10,000 range, Medicare Part B deductible for 2022 is $223. That is applied to whatever services you have first once you're enrolled in Medicare, and it's applied to whatever services you have first after January 1st, after you're enrolled in Medicare. Again, that deductible does increase every year, just like with all costs for Medicare. So you can count on that deductible going up a little bit each year. Once that deductible is met, Medicare pays for all Part B services, basically at an 80-20 split. They pay 80% of the cost, they leave the 20% balance. The other thing to be aware of is that Medicare premiums have become means tested. What that means is basically the more income you have, the higher Part B premium you may have to pay. That means testing is called IRMA, which stands for Income Related Monthly Adjustment Amount. The way that's going to be determined as far as who has to pay it and who doesn't is going to be that Social Security is going to access income tax or IRS files, and they are going to look at the most recent complete income tax filing someone has. In all honesty, the most complete tax filing year someone has is going to be potentially 2 years old, because we're in 2022, we have not yet filed taxes for 2021. And if we're lucky, our 2020 taxes have been completely closed and done with. So if you're becoming eligible for Medicare this year, Social Security is going to look at your tax filings for 2020. And if your income that tax year was be up above a certain threshold, you may get a letter in the mail from Social Security that says you have to pay a higher Part B premium. Now, having said that, and here's a chart of those thresholds. So an individual would have to have had an income of $91,000 or more in 2020 to have to pay a higher Part B premium. And if you have a $91,000 or more income, annual income, your premium could go from $170 to $238. If you have $91,000 or less annual income, you're going to pay that base premium of $170. If 2 years ago in 2020, you had a high income of $91,000 or more, but in the meantime, between 2020 and today, you have retired, you're no longer making that level of income, but you still get that letter in the mail from Social Security because they saw that you made that income in 2020. If your income is no longer at that level, you can appeal that and tell Social Security, I no longer have that high of income, so that you're not required to pay that higher premium if you no longer make that kind of money. So don't feel like you're stuck having to pay that, even if you have retired and are no longer making that level of income. That applies both individuals or couples, and the income thresholds are listed there. But again, the more you make, the more you may have to pay for Medicare Part B. So what does Medicare Part B cover? Again, as I said, a good rule of thumb is Medicare Part A covers your inpatient needs, Medicare Part B covers outpatient needs. So Medicare Part B is going to cover any and all types of doctor's visits. It covers all your x-ray and lab work. Medicare Part B covers medical, surgical, and anesthesia services, and Medicare does pay for medical second opinions. I mentioned earlier that no part of Medicare covers the first 3 pints of blood someone might need, but Medicare Part B will start paying for blood at pint number 4. Part B covers any and all medical emergency ambulance rides that you may need. Covers all your annual vaccines, such as the flu vaccine, hepatitis shot, pneumonia shot. Medicare Part B does cover the shingles vaccine, although only part of that's covered by the vaccine. The other part is covered by drug benefits, Part D. And I'm thinking that COVID vaccines will become an annual thing. And if that is the case, Part B would cover COVID vaccines every year as well. Part B covers all your outpatient physical, occupational, and speech therapies, covers all your durable medical equipment, such as oxygen, walkers, wheelchairs, that kind of stuff. And there are some limited coverages for other services, such as podiatry, chiropractic, and optometry. The key to Medicare to cover anything is going to be medical necessity, and that's for any and all parts of Medicare. Anytime you have a medical need or a doctor says you need to have a medical procedure, Medicare should pay for that. Anytime a doctor suggests that you may want to get a procedure done, may prompt you or should prompt you to ask them if Medicare will pay for that. Medicare does not cover non-medically necessary services of any kind. So some quick information about COVID coverage. Medicare does cover most all COVID-related needs, such as lab work, the COVID vaccines, COVID testing. There are a lot of things that providers do have to comply with. Other insurance options have to comply with specific rules for getting paid for those services. COVID-related hospitalizations are going to be covered. All those kinds of things are going to be covered by Medicare. And again, because this is probably going to be something we would want to get vaccinated again on an annual basis, Medicare is likely to cover the annual COVID vaccine if that becomes reality. But these slides just cover some advice and some general information about that coverage. Medicare is looking at potentially extending or maintaining their current telehealth coverage. In the past, telehealth had really limited coverage by Medicare, but because of the public health emergency, Medicare expanded that benefit quite significantly. And it does look like Medicare is going to continue allowing that level of or that type of healthcare visit from a provider through telehealth. We are not 100% sure yet if that is going to be a permanent benefit. I'm anticipating that it will be. We won't know until the public health emergency is officially ended, whether or not that's the case. But I do anticipate that it will be the case. It has become very convenient for many people. There are specific rules that have to be followed in order for a provider to get paid for that particular service. But Medicare is usually pretty generous with those things. Types of services that can be included under telehealth coverage. It can include hospital and doctor visits, behavioral health counseling, preventive health screenings, and it can meet the face-to-face requirement that Medicare has for some services such as oxygen. Types of providers that can provide telehealth services are going to be both doctors and nurse practitioners, clinical psychologists or licensed social workers, physical therapists, occupational and speech pathologists. Regular cost sharing does apply, meaning that Medicare pays 80-20 for these services, just like they pay for most other Part B services. There are some things that Medicare Part B does not cover, and that's going to be things that might be considered routine. So Medicare does not pay for routine physicals. They do not pay for routine foot care, hearing aids, or the fitting of them, routine eye exams, which would include maybe an annual eye exam to see if your prescription has changed or you need new prescription glasses. That's not covered. And even if you go to an eye doctor for a medically necessary need, such as glaucoma or cataracts, if the doctor does a refraction of your eyes, Medicare does not pay for refractions. Currently, Medicare does not cover dental. And you may have all heard the commercials or seen the commercials on TV that tout all these wonderful extra benefits, such as dental and the Medicare buyback. We're going to talk about all of that in much more detail next week, but Medicare itself does not cover dental benefits. And again, Medicare does not pay for anything they don't consider medically necessary, so things like cosmetic surgery are typically not covered. Even though Medicare does not cover routine physicals, Medicare does have a preventive benefit. Medicare, or people who are just becoming eligible for Medicare, would be eligible to use the use it or lose it benefit called Welcome to Medicare Preventive Visit. That is a benefit that has to be used within the first 12 months of enrolling in Medicare. It is not a physical. What it is an in-depth conversation with your medical provider to basically kind of establish a baseline. So it's going to be an in-depth conversation with your doctor about your family history, your personal history, your physical history, your social history. And it's going to give the doctor potential reasons to suggest you maybe receive other preventive services. Whether you take advantage of the Welcome to Medicare Preventive Visit within the first year or not, you would still have the option of getting an annual wellness review with your doctor. Again, that's not a physical, it's an in-depth conversation once a year with your doctor to review your health over the last year. And for that doctor to potentially suggest or encourage you to get other preventive services. Medicare does cover quite a few of preventive healthcare services. And it is a long, long list. I've listed 3 services on the slide, but there are probably about 40 or 50 services that they will cover offhand. The best way to find that complete list of preventive services that Medicare does cover is to look at the Medicare and You Handbook. The Medicare and You Handbook is a publication that Medicare sends beneficiaries every year in hard copy through the mail. And those handbooks are specific by state. So if you're just becoming eligible for Medicare this year, anytime before, say, August, you will probably get this book mailed to you automatically in the fall. If you're becoming eligible for Medicare anytime after August, you would have to call and request one this year. After this year, I would expect that you would get one in the mail every year automatically. In that handbook, there is like a 30-page section that details all of the specific preventive services that Medicare will pay for. It will describe the service. It will describe how often someone can receive that service and under what situations. All preventive services will be indicated by a little blue apple icon next to that description. You can also go online to the Medicare.gov website and look at that Medicare New Handbook and get that information in PDF form if you choose to do it that way. All right, so that is Medicare Part B in a nutshell. Are there any questions that anybody wants to ask? Again, you can unmute. I do have a question in the chat box that I will address. Hospital bills, Medicare, then Medicare will send my portion of the bill. I'm assuming the question is Medicare or the hospital bills Medicare. Medicare pays their part, leaves the balance of the $1,556 deductible. And where does that bill go? Is how I'm interpreting that question. Typically, that bill goes directly to you unless you have other coverage that would potentially pay that bill for you. Again, we are going to talk about those other types of coverage that might be an option for people to enroll in once they have Medicare next week in detail. But if you don't have other coverage that you have enrolled in or purchased to go with Medicare, then that bill goes to you and it's your out-of-pocket cost if you have just Medicare A and B. Any other questions about Medicare Part B or anything we've talked about so far? It's all clear as mud, I'm sure. This is a lot of information to digest in a very short amount of time. At the end of this presentation, there will be contact information. If you do have questions that you think of afterwards, you will be always welcome to email me, and I'm happy to answer any questions in the future. But I am not seeing or hearing other questions, so we will move on. We're almost done. There are financial assistance programs available to help cover the costs of Medicare for people who have limited or low income. These programs are called Medicare savings programs. Medicare savings programs are specifically designed to help Medicare beneficiaries pay some of the Medicare costs. So most Medicare savings programs that people can qualify for will at the very least pay the premium for their Medicare Part B, meaning if you are eligible and qualify for Medicare savings, you will not have that $170 deducted from your Social Security check. The state of Colorado will pay it for you. If you're at a low enough income limit or level, not only will the state pay your Part B premium, but it could also potentially pay your Medicare deductibles and co-insurances, any balance that A and B left over, so that you wouldn't need any other coverage besides Medicare and a Medicare savings program. If you're applied for and approved for a Medicare savings program, that does also automatically come with financial assistance for drug coverage costs. To apply for Medicare savings programs, it is required that you do an application through the Department of Human Services. Even though this is not technically a Medicaid program, it does require you basically fill out a Medicaid application. But this is a federally funded program, not a state funded program. It has just been found that it's the easiest way to apply for this program through a system that's already been established, because ultimately it is the state of Colorado that does cover those costs for you. But as with all financial assistance programs, there are income and asset limits that you would have to meet or be within those thresholds in order to qualify. So and I apologize for not updating the slide. We just got the updated information last week on the new income and asset limits for these programs. So for 2022, the income limit for a single person is actually $1,153. That is pre-deduction dollars, gross dollars. So, and that is from any and all income sources. Your income would have to be $1,153 or less, and you would have to have assets of $9,900 or less. And the asset limit does include a $1,500 burial exclusion. which means you'd have to prove that you have some sort of burial arrangement. Otherwise, that asset limit for a single person goes down to $8,400. Assets are going to include checking and savings accounts or any bank accounts you may have. It's going to include investments, 401ks, annuities, IRAs, those kinds of things, or any properties that you don't live on, anything that's liquidatable. It does not count the home that you live in, the car that you drive, or your personal possessions. If anybody wants any additional information about these programs, we do help people determine eligibility and apply for these programs. And we're always happy to answer other questions or talk to anybody in more detail who might be interested in getting more information about these programs. Again, for those who qualify, at the very least, it may pay that $170 of your Part B premium so that you save that money every month. And that is pretty much it for tonight. Again, this is presented to you by the SHIP program, which is your state health insurance assistance program. We serve 9 counties of Colorado. You can call the toll-free number for Colorado. It will route you to the SHIP office closest to where you're calling from. There are a total of like 13 SHIP programs in Colorado alone. And everybody in every state should have access to a SHIP counselor to get this free information education at any time. Because this is a government-funded program, we do work on a budget, and we are always looking for volunteers. If anybody is interested in more information about volunteering, we'd love to talk to you about those opportunities, or you can go to the shiptacenter.org website and get some additional information to see if that's something you're interested in pursuing. But we always welcome and are happy to talk to people about volunteer opportunities. Also, just to let you know that the Administration for Community Living, which is the agency that manages the SHIP program nationwide, in partnership with Medicare CMS, does have an ongoing national survey where you might actually be contacted by a survey contractor to ask you about any experience you've had with a SHIP counselor anytime you have a one-on-one conversation. If you get a call like that, that is a legitimate call, and we would encourage you and appreciate anyone who participates in a survey. Any survey results do go to the feds, and that does determine our funding for the year and whether or not this program can continue. Funding for this particular program has not increased in many, many years. And it actually has, luckily, it has stayed at level for the past several years. But every year we become a little bit more worried about whether or not funding at the federal level will continue to exist. So any feedback we can get from the public about the services we provide is always greatly appreciated. This SHIP office is also typically the SMP office. SMP is another program that we are participating in. It stands for Senior Medicare Patrol. Basically, it is the Medicare program that helps educate people on fraud and abuse of Medicare and Medicaid. We are always looking for volunteers for this program as well. And we are always encouraging people who have questions about claims. If they get questionable phone calls or emails or people knocking at their door, we always encourage you to either call us, call the state hotline, and the 800 numbers listed there. You can always visit the smpresource.org website. You can call or contact the Federal Trade Commission with any potential fraud suspicions. Anytime you think that there might be something suspicious going on, we encourage you to report it. We don't really care who you report it to. It's the reporting part that's important. So any of those entities You can call our office. We're happy to talk to you about anything that you think is suspicious. And again, this program is also always looking for volunteers to help educate the public on Medicare fraud and abuse. It is actually one of the more interesting parts of this job and one of the funner things to do as a volunteer. Again, you have these slides and we'll have my contact information at the end, and we're always happy to talk to people who are interested. And that is all I have for you tonight. Are there any other questions before I let you go? All right, I'm not hearing any questions. I'm not seeing any additional questions in the chat box. Oh wait, I do have a question in the chat box. Medicare have restrictions to qualify for pre-existing Medicare medical conditions. Okay, so I think the question is, does Medicare consider pre-existing health conditions? And the answer is no. Medicare does not care what your health is like. They will cover anything you ever need for any reason whatsoever, anywhere you're at, as long as it's necessary. Now, we will talk about pre-existing health condition issues next week when we talk about Medicare supplements and Medicare Advantage plans, but Medicare itself will always cover anything you ever need, whenever you need it, no matter what, as soon as you are enrolled. They never take pre-existing health issues into consideration as to whether or not they'll cover your services or needs. I appreciate the additional comments in the chat box. Again, I thank you all for joining us tonight. If you do have any other questions after tonight's presentation is over, I know sometimes it takes a minute to absorb some of this information. Here is my email. You're welcome to email me with any questions between now and next week. You're always welcome to call our office. We do have a total of 5 counselors right now who are able to answer your questions over the phone. Or again, if you're outside of our 9 counties, you can call the toll-free number and it will route you to a SHIP office closest to you. Always happy and able to answer questions. Email specifically is the best way to get a hold of me directly. But if you need an immediate answer during business hours, you can simply call that number and you will be routed to a SHIP counselor that's available. Again, if there are no other questions, I will let you guys go for the evening. Thank you for your attendance. I look forward to seeing you all next week. You will be sent a follow-up email sometime tomorrow or the next day that will provide you a link to a recording of this presentation, as well as a survey. Again, this is an internal survey above and beyond the one I just talked about. The survey that you're going to be sent will be for this particular program and this particular presentation, and any feedback you provide is always greatly appreciated. Otherwise, I will let you all go for the evening. Enjoy the rest of your evening and the rest of your week, and hopefully I will see you all next week. Have a good night.